Bismillahirrahmanirrahim. Assalamu alaikum and a good afternoon. I welcome you all to the Policy Dialogue webinar series. The topic of today's webinar is From RN to APRN. We're very much honored by the presence of our proud alumni, Rozina Virani. Thank you, Rozina, for joining us today. Before I give floor to Rozina to start the session, I would like to just give a brief introduction about Rozina to our audience. Rozina is our alumni from AKU-SONAM who has done her diploma in 1991 and BSc in 1996. She further studied and got her MSc from North Park University School of Nursing and Health Sciences in Chicago. She has recently earned her full practice authority license in 2023 from state of Illinois. I think so, Rozina, that's a great achievement. And, let's make it so much proud about our nursing. She's a board-certified family nurse practitioner and works in inpatient internal medicine department of Amita Health, St. Mary, and Elizabeth Medical Center, Chicago. Rozina's areas of research expertise are diabetes, hypertension, and asthma management. She enjoys teaching health assessment to MSc program at AKU-SONAM as a visiting professor, and she has been teaching in both undergrad program and NEMP students at DePaul University as adjunct faculty for past 6 years. She's an active member of American Academy of Nursing Practitioner and Illinois Society of Advanced Practice Nurse, ISAPN. She serves on various committees as a board member. She has also served at the Midwest Health Board Chair from the Smiley Muslim Community Center from year 2019 to 2023. So we have Rozina with us. So Rozina, I would like you to start the session. Thank you.
Thank you, Yasmin, for such kind introduction. It's my honor and privilege to be here representing all my alumni and share my journey with all of you. So thank you for having me. But before we go into the journey of APN role, I would like to start my journey when I was a student and when I started thinking about myself going into the nursing. As you know, that it takes a lot of thoughts and time and encouragement or courage to go into nursing. When I look back and when I look at when I was in 9th and 10th grade and I was choosing my profession, I wasn't sure where to go. At that time, we had only 2 professions for girls, I must say. Either you go in teaching or you go in nursing. So when I heard the chancellor saying nursing is a noble profession, I said, okay, why don't we go to the nursing? So I chose nursing. And then, shukr, alhamdulillah, that they fully sponsored me. And this was amazing. Out of 6 siblings, when one gets fully funded, I think it's amazing because then somebody's sponsoring your education. When I visited AKU, when I visited the School of Nursing, I fell in love with the environment, the safe, clean, conducive environment of learning was amazing. I said, this is it. This is my university. At the age of 19, I said, I can graduate here. So I chose that. And then the beauty and the highlight of this institution is the curriculum was amazing. It was actually partnered with the McGill University of Canada. And then they sent well-trained teachers from Canada and from America who came and taught us how to be an actual nurse here. So Yasmin, I've been a first generation who went to university. And this is another honor. I think I would take it as a feather in my cap. And then because of me, the impact was that 10 of my cousins, all female, went to this wonderful profession. And right now they are practicing in different areas. They are master's level, they are PhD levels, they are DNP levels. And this is a huge impact if you look at it, being a nurse. I just wanted to share that my when I finished my nursing in 1991, and I was, I was always a career-oriented woman thinking about, oh, what is next? What's coming up? So then they assigned me for the pediatric unit, and I was working as a novice nurse. And in the side, I've always kept in my mind that what is the next coming for me? And I kept working on my 3 Ps. The first P was my personal goals. And then in personal goals, I made sure that I was involved in my own care. So I took care of my hobbies. I started cooking, learning the spices and all that, because I've created or I developed this passion for cooking. And then for personal, I did that. And then on professional, I started looking at the opportunities in the areas. I know my slides looks a little wordy, but I just wanted to make sure that when I started in pediatric unit of AKU-H, we didn't have any parental education sessions. So I saw the gap there. And then I saw that we had very limited books for students or for our patients. So that was another need. And then I looked at all these toys were like really very, very limited quantity. So I started working on that part of it. We started conducting educational sessions. So looking at the gaps and developing the need and working on that, I think that works for your profession to grow. Right. And then, of course, my career path was moving. I became charge nurse. I was precepting the new novice nurses. I took a lot of responsibilities and QI committees. I loved grand rounds, presenting in grand rounds, learning about different diseases, learning to be good with my health assessment, because that's the key. Being a nurse at a diploma level, you wanted to work on that, right? And then for my public service, my third P, I started working for a community, and I joined the wellness center. This made me look very well-rounded. And then in the back of my mind, after 2 years, I'm definitely going back. I'm going to do the bachelor's, because at that time they started the bachelor's program came in. So my goal was to get my bachelor's from AKU-SONAM. And I think we were the first university who started the bachelor's program. And now we are phased out, right? There were no more diploma program. I know other areas are sending, but I think this was lovely. I was going step by step into my journey. So then next, if you look at my next slide, I was thinking about how to go to the bachelor's, how to do it. And I got picked. And then I chose to go full-time as a student in 1994. And my capstone options were either you do education or you do leadership. And I was always, my mind was always into education. So I picked my educational capstone project. What I did, I worked with, those nurses who were coming from northern areas, and they needed a little push to go into the nursing program, and I helped them. So I did educational session with them. I did mentorship for them. It was a great program. I think it was a great project. And then after completing my bachelor's, I went back to my same AKU pediatric unit and as a designated clinical nurse teacher. I think that time they were not doing the specialists. They were saying that because specialists are the masters prepared. So they gave us a clinical nurse teacher, and my responsibility was to not only teach students, to teach new nurses, come up with educational programs, packages, orientation for the novice nurses. And then, of course, in the back of my mind, I was building my resume and working on my 3 Ps again, professional goals, my personal goal, and I was working on my public service as well. I think these 3 P has given me a guidelines or like a little model for me to continue. So I was happy. I was very much involved in the unit based, and this RN knowledge has given me like a springboard. It gives me an energy and knowledge. It acted as a springboard so I can move forward. So that was my journey to RN to BSN. Then I got into the UCLA next. If you look at in my next slide, oh, these are the beautiful pictures I wanted to share with you. On the left upper corner, this is the lemon lighting ceremony. Do we still do it here? Yes. Okay. And then if you see on the right hand upper corner, this is when we displayed the whole pediatric care. And we did a setup for the high school students to come and watch us and get this inspiration, because we host a lot of our schools who come and see our curriculum and see us. So here we go. My passion for peds was rising as a student. And then, as you can look at it, I graduated as a bachelor's, BSc in nursing. And of course, this is my beautiful picture with the chancellor when I finished my diploma in nursing. These memories are amazing and wonderful. I'm sure we all, as an alumni, share this. Thank you. So I wanted to talk about a little bit of the bedside nursing. A lot of people talk about like, oh, bedside nursing, what is it all about? When I look at my bedside nursing, when I finished my BSN, I was always keeping in my mind that I have to go for my master's in education. And I applied to UCLA and I got into it. But then Plan B kicked in and I got married when I moved to US in 1998. So I took that. And at the same time, there was a huge trend going on of people becoming advanced practice nurse, which was totally new for me. And I didn't know much about it. So I said, let me explore this while I'm working in the US. So I had a very good time working from 2000 to 2013 as a bedside nurse because I was raising my kids and I was having a great balance of work life. I think work-life balance is really, really important for all our nurses, because sometimes when you're so much involved in our own career and our pathways, we forget about it. But it's very important being in a well-rounded nurse. You need to have your work-life balance. And I think being working in a bedside nurse, it provided me that. So I'm thankful for that. And I worked there, and again in a pediatric unit. And you won't believe it. They started promoting me right away as a charge nurse within 6 months, because the knowledge I took it from AKU was very applicable in the Western world. So I had no problem mingling with them, representing myself, being a foreign nurse. I just gelled in. So that was a good thing. It's all because of the curriculum, because our curriculum at AKU is actually competes with the international curriculum. It's a blessing. So then I started working on different policy. Now that this webinar is about policy, let me tell you, we have so many needs at the unit-based level to work on different policies, because we look at the gaps. We see there's an opportunity. Why can't we work and work on the policies? So I did had some dialogue with my manager when I decided to work on a policy where I spoke with the nurses and came up with a policy and decided when to transfer a very sick kid to the ICU. And we didn't have that policy. So being in a Western world, we think, oh, they have everything. It's not true. You're continuously working on the policy. So that one thing I just wanted to highlight here. So I kept my 3 Ps on my side. I worked on my professional level. I went to the research committee. I did my posters. I did my learning, stayed there. I brushed up my clinical knowledge, health assessment. And if you remember, 2000 was a big year for all of us, because all of a sudden, paper charting went into the electronic charting. I had a huge learning curve there, because within 1 year, everything was gone. From writing, we started learning computers. We started charting in computers. We started doing our care plans on the computer. So this was all learning. And because of AKU's knowledge, I was able to apply and adapt myself to go into it. So that was great. And I've seen a lot of our nurses over there are masters prepared. Here we think, oh, masters, if you got the masters, you should go and get either a teaching position or get a leadership position. But over there, these masters nurses are working on a bedside level and they love it because they impart so much knowledge with the patient, with parents, with the bigger, you know, bosses and managers. I think it's great. It's great to be a master's level a bedside nurse because you bring so much to the table. So I felt that, oh, maybe I can do that too, because my learning was increasing. I got better and better with my health assessment. I was able to communicate with my counterparts. Counterparts means doctors, nurses, the other coworkers. And I started working with them and I loved it. Flexible hours gave me more opportunities to work. And of course, I was giving back. I was part of the community services. I was traveling at that time. As you can see, I traveled to Alaska recently and I loved it. And I met some Alaskan nurses there. So you learn their way of teaching and communicating with the patients and providing care. So that was a good learning. So when I decided to really go back, if I can go back to the next slide, please. So as you can see, when I started working on my master's, because it was always in the back of my mind, I wanted to do it. I asked these 5 questions. Why? Why am I doing it? When am I doing it? Which university I'm going to pick? How I'm going to support my family? Who's going to take care of my kids? Because now I have 2 kids. And I'm going full-time or part-time. And there were so many options there because in West we have family nurse practitioner program, pediatric nurse practitioner program, women's health, adult gero, acute care, you name it and they have it. So because of my knowledge from AKU and my working, I was able to build up my resume, write my bio, and apply for the certification for master's. So finally, I decided to go to the part-time, and I finished my my nurse practitioner program in 3 years, and I kept my GPA 3.8 something. And then, of course, I met so many wonderful APN students and APNs, and also worked in my policy development wherever there was a gap. And so I never left the policy part away because there's always a need and you're filling that gap. So the next slide, I just wanted to share this, that when I decided to pick up as a family nurse practitioner, even though my strength was in pediatric, this was the trending one because the scope of practice of family nurse practitioner is huge. As a family nurse practitioner, you can work in any clinic, you can work in a hospital, and you can provide care to 0 to 99 years of age. And peds was my forte. So I said, maybe this is the best thing I can do. So I'm just, I wanted to share what courses I took because it's a difficult course. Family nurse practitioner is not easy. You have to provide a lot of hours in there, a lot of clinical hours goes in there. In 2013, there was no nursing residency program because we did so much clinicals there and clinical hours in nursing. And now that they wanted to give more, so they started the nursing residency, clinical hours. I think that's what we are studying here too in our APN rules. Next slide, please. So a lot of people ask me, what is my role and responsibility as a nurse practitioner? And I wanted to say, transition from a nurse to APN is difficult. Remember, you are at the bedside level, but now you are in the shoes of a provider where you are not only looking at the nursing part, but you're looking at the holistic part, like caring part, what you're going to do, how you're going to care the patient. So of course you need to have a very, very good assessment skills. You need to have how to take a medical history, how to take family medical history. I am supposed to document everything. I need to take a review of systems. And then I need to order labs, interpret labs, create a plan where I am giving them medications, reevaluating, evaluating, following up. and working with my team. So it's a different lens, but your nursing knowledge, it just pulls the path. It builds upon it. So these are some of my responsibilities. So as you know, that in the back of my mind, I was always thinking, now I'm APN. I worked as an APN for 10 years. I need a full practice authority. So then I applied and it took me 9 years. It's a long process. It has a lot of requirements, which I'm going to discuss in my next slide. So I just wanted to share a few highlights here that I am accredited with American Academy of Nurse Practitioner. I am supposed to have 250 hours of continuing medication education. And it's not easy because by the time you go home, you're done, you're not sitting on the table. So I made my routine that weekly, I'm sitting in my lunchtime and doing those continuing education hours because you need to keep up with your licenses. You're renewing it on time. You're networking constantly. You're going to those events. On the top, you are protecting your license because you're working under the scope of practice. And it's very, very important as an APN. Next slide, please. So what is APRN with full practice authority? A lot of people ask me like, so what is the difference? Why do you have to go pay more money? Does it increase your money? No, it doesn't. But then the beauty is, if the rural areas where there is no doctor, I'm the only provider there. I'm the nurse, I'm the clinician, I'm the one who's diagnosing, giving them medicine, following up. I don't need any doctor. I don't need anyone to sign my orders. I am whole and sole responsible. Of course, with full practice authority, it brings a lot of responsibility and you want to work in the scope of your practice. So you need to keep your good standing position license. You have to be accountable for what you're doing with your patient, right? Because that's a huge thing. And of course, I am in the back of my mind, I always keep my 3 Ps, which is personal goal, professional goals, and my public service. And currently, I'm part of the DNP journey. And when you ask me, a lot of people say, hey, you can do it. You should go get your DNP done. I enjoy my life. I take it easy. I don't run. I absorb things. I go slow. It's a good thing to go slow. You don't have to fast. So that's me. And a lot of our nurses are like that. You want to enjoy your work-life balance. You want to enjoy your life too, which makes you well-rounded. And our mental sanity. I work for my mental sanity, and we nurses need that. We often forget about our own mental health. So I feel like I take my time. So currently I'm enrolled in my doctorate in nurse practitioner program. And as you can see that I love networking. I'm part of Illinois Society of Advanced Practitioners. Next slide. As we were mentioning about the scope of practice, so these are the 4 pillars for advanced practitioners. The first one is your professional role, means you are taking responsibility, what you are professionally acceptable, right? Then you make sure that you take your optimum education, you are master's level, you are certified, you have your license in good standing, you're accountable for your act. And it's a huge thing. If I am giving someone a medicine, if I am diagnosing them, it's important. It's very, very important to take accountability because you spend so much time, hours, and your effort and money. You don't want to lose it, right? You want to protect that. And of course, you take responsibility. And these scope of practice are given by American Academy of Nurse Association, and they just reviewed it recently in 2022. So this is the nutshell of the scope of practice. As I mentioned, what is it all about? If anyone needs a full practice authority, scope of practice, we can print it out and give it to them. So as I mentioned, professional role is very important. Next slide, please. And then, of course, you need to have that education level. And I feel like Yasmin, sometimes we forget about our clinical experience and clinical expertise. It's so important to have your clinical expertise with you because it makes you genuinely a nurse practitioner. And then next one is of course, your accountability. You're accountable. You need to follow an ethical code of conduct. And we do have PNC code of conduct as well, right? So we have to follow in whatever state or country you live in. You need to follow your code of conduct. You need to work on your evidence-based practices, and you need to provide your cultural sensitive care to a diverse population. And of course, you take responsibility. You say that I'm MP, this is my responsibility to meet, to involve with other stakeholders, collaborate with people, administrators, work in research. So this makes you well-rounded. Of course, as an NP, I make sure that I provide safe, high quality, cost-effective, and patient-centered care. So what am I doing moving forward? I feel like Yasmin, AKU is doing an amazing job in bringing the curriculum for APRNs and acute care. It's amazing. I think our institution well deserved to establish this curriculum, and a lot of our faculties are working really hard to work on policies, to work on this curriculum, that this is needed. This is the new trend, and we cannot be behind. So, of course, moving forward, we need a good curriculum, a best curriculum for undergrad and graduate level, which AKU is committed and is doing. Strong clinical competency. I think I would reemphasize and emphasize again and again on that. Enhancing the critical thinking. I think the both can go interchange, because when you have a strong clinical competency, it creates an environment of critical thinking. And of course, it sharpens your skills, right? So it's all related to each other. It gives you leadership roles. You're going to look at all the gaps. You're going to start filling those gaps. So leadership comes in because you've taken that role. You're going to be advocate not only for yourself, for your coworkers, but for your patients. So that's another role in policy making. Then you, of course, you're going to make policies. Yasmin, people say, "Oh, people are making policy at the above level." I always say policies are done on the grassroots level. There's always policy. Like I created one policy at the unit level. We can do it at the unit level. We can do it at the institution level. We can definitely go and make it a national event. So please. We need to continue doing that. And I think you guys are doing an amazing job. Mentorship. I think we need to provide more mentorship to our new novice nurses, students. We need to continue those type of programs. I took mentorship when I was a novice APN. Everyone needs that. So I know our faculty does that good job. Then providing a cultural sensitive care. I think this is so important because we have a diverse community. They come even in our different parts of our Pakistan and in the world. It's our world is becoming one. We have so much different diverse population living, and we are constantly providing diverse care. So we need to work on that, or maybe create some curriculum which can talk about cultural sensitive care. So that's what one of the points I wanted to talk. And of course, make it a collaborative effort. Collaboration between school nursing and AKUH, and I know you guys do it. And of course, with the policy, with the faculty development. So I know you guys do a lot. So we need to continue doing that and look at those gaps and deploy those people where there's a need and according to their strength. I think that's the key area. And of course, don't forget the 3 Ps, right? We need to work on our 3 Ps. So I feel like this is what needed, and we should move forward for that. Yeah. If you look at, if you want me to conclude this, I would conclude with this. But nursing knowledge gives you a springboard or a trampoline. And then once you become a bachelor or speaking of nurse, it gives you height. As you can see, she's going up, but she can move back safely on the trampoline or springboard, but she was able to see the surrounding areas. So the worldview has expanded. And then, of course, if she gets masters, if we can see if this is a nurse and she gets masters, she can jump higher and look at the worldview even better. So I feel like our nursing career gives us this springboard and gives us the opportunity to live safely and go in and see more, see the worldview. Another analogy, I wanted to give it to you about the next slide. And I talk about this, that nursing is, when you're island, you're looking at the tip of the iceberg. When you become bachelor's prepared nurses, you're looking at the core. But when you're becoming APRN, when you full practice authority, then you know exactly how much deep down the need is. When you work on that, you're not only looking at the tip of it, but you're looking at the mirror images. You're looking at how much is deep down there. You're doing patient advocacy. You're doing advocacy for your nurses, for your students, for your fellow, for, you name it and you do it, and families, and you're providing holistic care. So my message to all our nurses is do not stop at one point. Take it as a springboard and take your time. Do not rush, do not run. Take your time. Enjoy life because we have only one life as a nurse. So don't make it hectic. Enjoy and fully enjoy the view. Thank you.
Thank you so much, Rozina. Wonderful hearing your thoughts. And I think so. This session is going to be very inspiring for all the nurses who would like to opt for APN or maybe full practice authority. And I think so. I just would like to summarize a few of the salient points from today's lecture. I think so. You really talk well about 3 Ps. And I think so. This is a take-home message for our nurses that, if you have your personal goals, very clear professional goals, and you focus on and you consider the public service, I think so you are going to make it. You are going to nail it. So thank you so much for those 3 Ps. And I hope that the students or the audience who are listening, they will also adapt and, apply. One more thing I really like that, work-life balance. You are a remarkable example, the way you raised your 2 kids and did everything, one another. And you're so happy that you are one of the full practice authority nurse who have got this license very recently. But it's so inspiring, I would say. And I think so it's again a message for all of us that how much our mental sanity is important, how much is it is important to have work life, personal life and work balance. And lastly, I think so you very well talk about those competency, or you can say scope of practice, which has been given by American Association of Nurse Practitioner, that, nurse is taking a professional role, but is also involved in education. There's accountability, and she has to really look at that scope, that how she can contribute. And one more thing, responsibility. So these 4 things were really, I think so amazing. I think so those who were listening, if you have any question, then you can write your questions on outreach.sonam@aku.edu. So we have received few questions, and Rozina, I'll read out the questions and then you can reply accordingly. There is one question that what is the role of APN in policy development? And if you could share the challenges which are faced to opt the role of APN, what challenges you faced, and how the people who would like to opt the role, they can overcome those challenges. Thank you.
I think this is a very, very important question. That why do people opt for APN? Sometimes they do their masters, and I've seen nurses doing their masters and sticking to their, bedside nursing because they enjoy it, they love it. But some of them has this courage because they have learned so much. You've seen everything. Now you want to move forward, so you go into the advanced level, journey, or you get your advanced practice nurse license because you feel that you're there. It comes from inside and it gives you that passion. So you go there. But there are a lot of obstacles. Yes, I remember working full time, going to school part time, raising 2 kids, young kids in middle school. No, they were not even middle school. One was the elementary school, one was in a middle school. And putting your heart and soul in studying, keeping up with your GPA. you are afraid that you don't want to see, otherwise you're kicked out of the curriculum. I have chose the hardest one. So I had to stay put. But still, I kept the work-life balance. I still went to the vacation. I still took some time out to work on my personal 3Ps. And if you organize yourself and you look at those 3Ps and you want to work on it, you can do it. I think it's doable. But there are certain obstacles. Of course, money is another thing. You need a funding. But because of AKU, I was able to secure my place for a Dean Scholarship. So that was good. I think AKU nurses or any nurse who works hard can get those challenges accomplished. Yeah. So challenge is going to come, but it doesn't mean that we have to set back. You need to find a mentor, talk to people, go to your advisor, talk to people, and stay put. Yeah. There's always a way.
And you shared that you are the member of ISAPN. So you could just highlight your role there.
So American Academy of Nurse Practitioner is the credentialing place which provides me the license. This is where I get my license from. So in Illinois, we have come up with few nurses have come up together and we have made Illinois Society of Nurse Practitioner. And this year we did our first APN networking event. And because in November, we celebrate NP week, right? Like we do it in May, our Nurses Week, we do NP week. And they invited me to join this. It's by invitation, or you can join as a committee member. And then I feel like there are so many roles for, there's so many opportunities there that you can do advocacy role. You can go into different committees and then you can be part of it. Like I am in a membership committee, so I go give a talk. Why is it important to join this? We make an advocacy group. So let me give you this example. I'm glad that you brought this up. So as an APN, we were not allowed to write a prescription for certain drugs. So we nurses lobbied. These nurse practitioners, we lobbied, and we said, now we have a full practice authority. We should be okay to write those controlled substances, Ritalin, some psychiatric or psychotropic drugs, they were not allowing us. But because of these societies, these networking places and APN roles, and it gives us, again, a springboard, because we all are jumping together, right? So when we jump together, people see us and we make a difference. So I think I would urge everyone to be part of PNC, to make their own committees, get involved into committees, because these are so important. They do advocacy for nurses. They get so many things approved for us. And I feel that I'm lucky that they have invited me and now I'm part of it. I'm actively in a part of advocacy group. This April, we are going to Springfield, which is our capital, and we're going to go and propose some more policy changes. Again, policy changes, because that's the underlying message.
So I think so. It's very clear that, we can see that Rozina is working so much and she's so much involved in policy making, development. So we can also be hopeful that, a time will come when nurses will be involved and will be the part of policy, inshallah. And I think so with the role of AP in Pakistan, the things will move positive. There's one question by our MECN student, Shafiqur Rahman. Thank you, Shafiq, for your question. So he's asking that, is there any policy stipulating that a doctor must countersign all the prescription made by APNs within 8 hours? If not, could you please clarify why we should have this requirement in Pakistan? I think so Rozina is coming from different contexts, but maybe Rozina, you could reply on that. Yeah.
So before getting my full practice authority, I always get it co-signed with my collaborative agreement. I have a doctor who does that. One more thing is, when you are practicing by yourself, let's see, if I set up a clinic, I can sign my own orders. I don't need anybody. But when I work in hospitals, and recently I work in a hospital because I have a role of hospitalist. So I admit patient, I look at patient, I discharge patient. In that case, I do have a collaborative agreement, because none of the hospitals are still allowing us to work as a full practice authority because every hospital has their own agenda and the way they protect us. And I've seen a lot of nurses think, oh, they have to sign my orders or they have to look at my notes. Don't feel threat. Listen, this is for our safety. Somebody is eyeballing your notes. Somebody is eyeballing your diagnostic tests. If you're ordering $1,000 test for CT scan or MRI, and if insurance company or people will come and they, why did you order this? This is not the gold standard. X-ray is the gold standard. Why did you order that? You have someone to back you up. You have hospital policies to back you up. You have your doctors to back you up. I think in Pakistan, we will definitely need a collaborative agreement because it's a new role. Right, Yasmin? Because this is a very new role. And acute care nurses, I think they will definitely need to be buddied with the collaborative MDs. I'm talking about family nurse practitioners who are doing clinics in our areas. So it depends on countries and states where you are and what the policies are. Again, the policy. But if Pakistan generates enough APRNs and they get into the springboard and they start asking for full practice authority, nobody can stop you. I hope I answered this.
Absolutely. I think so. You just responded so well. Shafiq, if you have more questions, then you can write to us. But I think so, Rozina, you highlighted so well that, it's just the introduction of APN in the country. It will take some time to, go there to get, recognize. I think so time will come that, when we will prove ourselves with this role, a time will come that, we will be able to contribute more. And I think so what I loved about your presentation is your trampoline effect. That your springboard is your competency, your knowledge, and more you go up and you explore and come back, and more you go up and explore. So thank you so much. I think so I'll just ask you if there are none. Then there's one question. Okay, so one question is from my side. But what would be your message to our young nurses? I can see that a lot of people, young nurses, they would just like to go abroad and they would like to, opt for nursing over there. So what will be your take-home message for our young nurses and the nurses who want to become APN in Pakistan? What will be your advice?
Thank you. I think the most important thing is to expand your worldview. Do not focus on one thing. Be good in your health assessment. In assessment, I'm telling you, if a nurse is good in hearing a murmur in the hallway, this is just a saying, right? Without the stethoscope, you're a good nurse. If a doctor comes to you and say, hey, what do you think about this patient? Do you want to take him to the OR? Or do you think I can send him home? And you said, I don't think so. He is patient with the appendicitis. You need to take him to the surgery. And you are so damn confirmed because of your assessment. And the doc comes in and talks to you. Before making decision, you're a good nurse. And I've seen the more I've worked on a bedside level, I've earned this. So please earn yourself. Earn your respect, your value by getting best to what you do. Best in your health assessment. Best in learning education, because a lot of time we look at the bookish knowledge, but when we go and start applying it, it's totally different. So make sure that you learn different cases. You learn how to apply your nursing knowledge to that. And then when you collaborate with your counterparts, with your MDs, with your CNAs, with your therapist, with your pharmacist, you enhance. Again, these are the people who are going to help you to get onto the springboard. So now you're springboarding with the whole team. So you're not only empowering yourself, you're empowering the people around you. So get the bedside nursing. Do your bedside nursing. I think bedside nursing will take you wherever you want it to go. And take your time. Do not start running. Yes, make your goal. But then always take your time, learn, absorb, and take care of yourself as well. Work-life balance. I always say work-life balance is so important that it makes us a very well-rounded nurse.
Thank you, Rozina. I think so. No more questions. So I just would like to say thank you on behalf of Outreach and Policy Unit of AKU-SONAM. Thank you so much for your time. You are so generous. I think so. You're here for the family visit, but you just accepted our invitation, and you were. I think so. Your story is so inspiring, and I hope that the nurses who are listening, they will get benefit out of it. And if you would like to have more questions, you can write to outreach.sonam@aku.edu. Then we can post to you, and then you can reply.
Absolutely. Yasmin, I think we all have stories.
Yeah.
We just need to come out and share.
Yes. Thank you, Rozina.
You
were courageous enough to come and share your story. It's inspiring.
Thank you so much, Yasmin. Thank you, Dr. Rafa. Thank you, Rozina, for having me here and being so hospitable. Thank you again. Thank you.
Okay, with that, I just would like to announce that our next policy dialogue series on APN, Advanced Practice Nurse, it's going to be soon. I think so. After 2 weeks, we are going to announce. So our speaker is Dr. Rozina Virani, another APN nurse. She's assistant professor, adult and neurological nursing in Rush University College of Nursing, Chicago, USA. So stay tuned. Zara will be sending you the flyers out. You will see the flyers from Outreach Office. So hope that you will join our seminars, webinars, and will learn about the role of APN. That, thank you so much. Thank you for your time. Thank you for joining. Take care. Lafaz. Thank you.